Hey guys, Alex Winter here from Blue Wave Insurance. Today we're going to talk about Medicare Supplement Plan G versus Medicare Supplement Plan N in 2025, the difference in benefits, difference in cost, and which one would make sense for you. So just a reminder how the Medicare supplement plans work. There's no networks when it comes to Medicare supplement plans, which are often referred to as Medigap plans. The way they work is they pay after Medicare. So your original Medicare A and B remain primary, and the Medicare supplement plan pays after Medicare has approved the claim and processed it and sent it to the insurance company to make the payment on. So Plan G and N handle claims the same. You can go to any doctor in the country that takes Medicare with either plan, regardless of the insurance company that you're with. Plans are standardized, there's no referrals, and drug coverage is separate, referred to as Part D. And international coverage is included on both G and N, $50,000 reimbursement for the first 60 days of travel for emergencies only. Quick chart of all the Medigap plans. I've highlighted G and N so you can see them and the differences. A nice visual there. You can see Plan G does not cover the Part B deductible, and then Plan N doesn't cover the deductible, excess charges, and then there's an asterisk here on the Part B coinsurance or co-payment, which we're going to dive into right now. So Medigap Plan G is the most popular option in 2025 because it's the most comprehensive plan for people who are new to Medicare in 2025, cannot get Plan F. So Plan G is the most comprehensive plan available to them. Plan G has an annual deductible $257 in 2025, no co-payments. So very straightforward. No matter how many times you go to the doctor or a specialist, as long as it's a Medicare approved service, you'll have no co-payment on Plan G. You'll just have a deductible. The way that Part B deductible works, and it's the same for Plan N and Plan G, the Part B deductible, is you go to a doctor, let's say in January, and you get an MRI done and some blood work, you'll pay the first $257 for those services, and then you're done for the year. So once you meet the $257, no out of pocket for the year on a Plan G. That's it for Plan G. Plan N, very similar to G, but it has a office visit co-payment, $0 to $20 at each office visit. Now to clarify, that co-payment can range anywhere from $0 to $20. It can be at $10, it can be $12. It depends on what is billed by the doctor and what's approved by Medicare, but it's a maximum of $20 for each office visit. $50 at the emergency room. You pay $50 at the emergency room on Plan N. If you're admitted into the hospital at the emergency room, so you go in for stomach pains and say, oh, you need to have your gallbladder taken out. We're going to admit you. No $50 copay. It's waived. You get a free ER visit, I guess. So $50 at the ER, waived if you're admitted, $0 to $20 at an office visit on Plan N. Same deductible as G. $257. One thing that's in addition to this that's not covered is excess charges. Everybody says, oh, excess charges, what the heck are excess charges? So excess charges can occur on Plan N if you go to a doctor that does not take what's called Medicare assignment. Medicare assignment means the doctor has agreed or not agreed to Medicare's billing terms and billing amounts. So if they have agreed to Medicare's billing terms, then whatever they bill to Medicare, Medicare will knock it down to the approved amount, and then the provider says, okay, that's fine, I've already agreed to that. And what if your doctor doesn't take Medicare assignment? If they don't take Medicare assignment, they can overcharge the Medicare approved amount, but under Plan N, you'd be only responsible for 15% of the overcharge. So, and that's on the Part B services. So Medicare Part B excess charges or overcharges is only on Part B, and it's limited to 15% over the Medicare approved amount. And that only occurs if your doctor does not accept Medicare assignment, which is agreeing to Medicare's billing terms. Let's take a look at like premiums, when it would make sense to go from a G to an N, vice versa. So generally, there's a $300 premium savings between G and N $300 or more is what we see. Decision's up to you. If you think $300 is worth it, the way that we usually break that out is how many office visits do you think you're going to have in the year? At $20 a pop, 10 office visits, 200. Okay, so you still save $100 on the end. So usually how we break it out, but if you're somebody that doesn't go to the doctor very often, maybe there's a $500 difference where you are between G and N, that would make the decision easier to go with N. Or vice versa, if you go to the doctor a lot, and the $300 isn't really worth it to you, then the G will be the better option. So it's really up to you. But we usually do see less rate increases on the N because Plan G is what's called the guarantee issue plan for folks on Medicare. Guarantee issue means you're losing your coverage, you're losing an Advantage plan, you're coming off an employer plan, you're not healthy, then you're able to get a G, no health questions asked. So what that means is there's potentially more unhealthy people on Plan G than there are on Plan N, which factors into the annual rate increases that we see. So we do see lower rate increases on N than G because of that. But also note that the same coverage in the hospital is provided under both plans. So at the end of the day, you go into the hospital, you're in there for a few weeks, you have a big surgery, hospital coverage is the same on both plans. So there you have it, G versus N. If you have questions, give us a call at the number below. We'd be glad to help you out with plan comparisons, free quotes, questions or answers to your Medicare questions. So give us a ring, number below. Don't forget to click like and subscribe and stay updated on all things Medicare. Thanks for watching the video, and we'll see you on the next one. Thank you.